Yeah, we'll give it a few more minutes as the participant list will get more stable.
Okay.
Well, it looks like the participant list is getting relatively stable. Let's get started. Thank you all for joining today's Geospatial Fellows webinar. I'm Xiaowen Wang from the University of Illinois at Urbana-Champaign. I'm serving as the PI for the National Science Foundation Geospatial Software Institute Conceptualization Project. This NSF project organizes the Geospatial Fellows webinar series in partnership with AAG, UCGIS, OGC, NORC at the University of Chicago, and UIUC's CyberGS Center for Advanced Digital and Spatial Studies. I want to give a shout out to several colleagues on the organizing committee of the Geospatial Fellows webinar series. Quickly mentioning Dr. Colleen Doney at AAG and her colleague Jolite Nilupa. I'm learning how to pronounce her name. And my UIUC colleague at the CyberGS Center, Dr. Anand Padmanabhan, and also my PhD student, Becky Vanderwally. So thank you all for your terrific work for helping organize the webinar series and making today's webinar smooth. Now I'm very delighted and honored to introduce today's speaker, Dr. Sung Gao, who's a professor of geography at the University of Wisconsin-Madison, where he directed the Geospatial Data Science Lab. Dr. Gao is a rising star in geographic information science. His research interests primarily include place-based GIS, human mobility, and geospatial artificial intelligence for social sensing. His topic of research today, his lecture specifically going to be addressing mapping human mobility changes in the geospatial modeling of COVID-19 spread. His lecture will be discussed by Dr. Kathleen Stewart, who's a professor in the Department of Geographical Sciences, and she directed the Center for Geospatial Information Science at the University of Maryland, College Park. Dr. Stewart is an internationally renowned scholar in geospatial information science. Her research interests is quite broad, cutting across geospatial semantics, ontologies, and dynamics, with a particular focus on mobility and spatial access motivated by real-world applications such as in transportation and health. So we are very much looking forward to the lecture by Dr. Gao and the discussion by Dr. Stewart. Without further ado, let me invite Dr. Gao to start his lecture. So So please take it away.
Yeah, thank you very much for Dr. Wang's kind introduction. So I'm going to share my screen now. So can you see my screen now?
Yes.
Okay, great. So hello everyone. Thank you very much for joining the Geospatial Fellows webinar today. And my talk today is about mapping human mobility changes and geospatial modeling of COVID-19 spread. So before I start my presentation, I'd like to specifically acknowledge the support from the NSF fund about this project, and also Professor Wang's Geospatial Software Institute support for this fellowship. And this project is collaborated with my 3 other co-PIs, Professor Qing Li from mathematics, Professor Kaiping Chen from science communication, and Professor Jonathan Patz from public health, all of them from UW-Madison. And also, this project has been held by a lot of my undergraduates and graduate students, specifically Jing Meng and Yu Hao, who are actually still maintaining, updating the data repository and keep updates the mobility dashboard almost for 1.5 years now. So really, thanks their great efforts. So let me start. Last year, as we know, because of the COVID-19 pandemic, because of characteristic of this virus, the transmission is based on close contacts. So this is why a lot of efforts have been conducted to understand the human mobility pattern, because the spatial transmission was caused by the mobility and by human travels. And we found out that there is we call it open data or spring up phenomenon, which means that a lot of companies actually they share the mobility data, as we know, such as Google and Apple mobility reports, and also a lot of proprietary companies such as Cubic, SafeGraph, among others, also share their mobility data. And so this is actually provide a great opportunity for a lot of researchers in this domain, because we have utilized a lot of different sources to study human mobility for decades. And for us, we responded this very quickly, especially for US, because we learned that from the work done in China about a similar work about mapping human mobility, but from different data sources. So the first framework we built consists of 3 layers, namely the data and feature and methodology implication. So at the data layer, we accumulate different data sources about human travels, such as from SafeGraph and from GeoDS Lab, and also other data providers, including both individual level and the aggregation level mobility data. And after we accumulate those mobile phone data sets, and we can further aggregate at the different geographic scales and analyze the mobility patterns, such as some mobility statistics, such as travel distance, stay at home time, or could also extract the travel origin destination flows. And further, we can expose and publish those data sets and utilize visual analytics to show the pattern. So this is the first mobility dashboard we built in the US. And this work has also been reported by a lot of media news. So this is the animation about this platform. In the map, you can see here is the choroplast mapping. If the county shows in red on that particular day, which means that there was increased mobility changes for that county. If it is blue, which shows the reduced mobility regarding the baseline. And the baseline is before the pandemic, measured by the median of the travel distance per user. And then we wonder, after the stay-at-home order placed in different states, how humans responded to those orders. So this is why we further analyze the 2 specific mobility measures. One is the travel distance change rate. Another is a home dwell time change rate. And we found that both of them actually are statistically significant, associated with the COVID-19 confirmed cases in each state. However, I collaborated with another researcher, Dr. Huang Xiao. We actually interested to see from the geography's perspective whether such a disparity issue exists in the in human responses to the stay-at-home order. So what we found in this follow-up research is that staying at home is a privilege. So which means that actually a lot of socioeconomic attributes are associated with the human responses to the stay-at-home order. So specifically, here we look at the based on the mobile phone data, we look at the median home dwell time for a specific sensor block group. So and on a particular day, and then we select based on different state orders, we can define a responsive window, which extends 7 days before and 7 days after the order, and the baseline is before the pandemic. We choose theme long duration, and then we measure such changes. And as you can see from the figure, here we selected those most populated metropolitan statistic areas in the US, and those 12 MSA areas, we found a different pattern. For example, in New York, as we know, because of the seriousness of the COVID-19 infection at that time, you can see much more consistent and stable, longer stay-at-home time during the responsive window. However, in some areas, such as in Washington, D.C., actually you see a lot of fluctuations about the density distribution of the stay-at-home orders among different neighborhoods, which means that there is spatial heterogeneity, and also we can show the disparity later in the variable analysis. Here are a couple of variables we analyze using both regression and also a random forest. So here we show you the feature importance ranking based on the random forest model, and you can see the top two most important features that determine the previously mentioned the stay-at-home time change rate or median household income, and also the percentage of the high income people in a specific neighborhood, that is a sensor block group level. So in other words, we found that actually whether following the stay-at-home order are also associated with those socioeconomic status significantly. We have several discussion in the paper. And we think that on one hand, maybe because lower income people, they cannot afford to, stay at home because they want to afford the life, or they can, because of the job occupation type, they cannot, keep staying at home, or lack of, cyber access. So there are a lot of speculations, and our research is published in Annals of the American Association of Geographers, and this research was also nominated by the Annals AAG for the Taylor Francis, the publisher media promotion. And as I mentioned, on one hand, we utilize large scale, millions of mobile phone devices to understand the mobility patterns. But on the other hand, we found that a lot of open mobility data do not have the origin to destination flow pattern. So which is very important for the epidemic modeling. So this is why in the follow-up work, we built such a human mobility origin to destination flow open data repository on GitHub. And we, based on the anonymized mobile devices, we aggregate the 3 geography scale OD flows at the state to state level, and county to county level, and sensor tract to sensor tract level, because a lot of COVID-19 confirmed cases are at these 3 levels. So we hope that actually researcher can utilize those different 3 levels OD flows and to enrich their epidemic modeling. So later, I will also show you how we utilize this data set in our modeling effort. So one one step before we move into the modeling is that because even for, we conflate a lot of different sources, as we know that especially in the US, a lot of data sources only cover about 10% of the entire population, and also only based on the mobile devices. So in other words, we need to extrapolate the mobility pattern to cover or to represent the population level. So this is why we need some extrapolation method. So here we actually choose a very simple one, and that is based on the ratio of the active mobile devices in a specific neighborhood, and then based on their sensors population, and then to extrapolate the population flow. And this is like empirical computation. We also compare the results with well-known two spatial interaction models, the gravity model and then the radiation model. So for those of you who are not familiar with the gravity model and radiation model, for gravity model is an undirected spatial interaction model, which means that we do not consider the direction of the flow, only consider the nodal attraction. That is, we can use such as population, that is a PI, PJ, and then in spatial interaction is in reverse proportion to the distance, so which we know as the distance decay, and then the beta as a decay coefficient. So based on the different weekly flow data, we can find out we can calibrate the model based on the observed data, and then to have a different distance decay coefficients. And we can also compute the correlation with the estimate data. Because this is undirect flow model, and then the radiation model is a directed flow model. So this is why we got a higher correlation with observed one with the radiation model, because also relevant study have shown that the radiation model is better than the gravity model, especially when we measure the longer distance spatial interactions. And gravity model really is good at the metropolitan level spatial interaction modeling. And lastly, one characteristic or challenge about big data or big mobility data research is we do not know the ground truth. So in other words, how to know the reliability or credibility of the derived data set. So one way of doing that is we can utilize cross-validation among different mobility data sources. So look at their temporal changes or other quantitative information. So for example, we compare the population flow derived from the SafeGraph mobile device social distancing matrix data with the GeoDS Lab mobility data, because we assume that they are from different data sources, and if they show a high correlation, and they might actually, to a certain degree, it might show that okay, this data could be representative to the the population we are observing. And so next, I will show you two modeling research about how we utilize the derived mobility data in the COVID-19 geospatial spread. So the first one is about the state-specific geospatial modeling of COVID-19 spread. This work was published on scientific reports, was also among the last year published paper, attracted the top 100 most viewed. That's also in the COVID-19 collection. So what we did, we utilized the previously mentioned the OD flow between different locations, and then we augment with a classic epidemic compartment model, that is a SEIR model. So S represents the susceptible population that could be infected, and the E represents the exposed people from the virus, and the I represent those infected group, and remove as R, which means either unfortunately dead or recovered. So those are the classic four components. However, one innovation we made in this modeling is that we consider that because of the characteristic of this virus and also the situation in the US at that time, we believe that a lot of cases are undetected or unreported. So this is why we further split the infected group into two components. So that is, infected and reported, and infected but unreported. So we differentiate those, and then the components shown in the ordinary differential equation system actually representing the mobility components. So which means that because of the state-to-state or country-to-country travels, and those are the people, either they are susceptible or they are exposed or they are infected. This is how they can travel among different places, how they transmit or potentially transmit the virus. So this is why we build such a mobility network-based SEIR model, and to understand the state-specific modeling in early times. And some more detailed about based on the OD system, which is we based on a Bayesian theory. This is the OD itself is like a prior information, and then the observed daily confirmed cases or other information could be the the observed data to actually to inform what could be the the status of those parameters that drive the evolution of those systems. So this process we show you is a data assimilation process, which means that we want to use observed confirmed data and to infer the static variables and then the parameters in the system. And in the process, we want to minimize the prediction error term. So what we found was that, because I mentioned that there are several parameters, including the transmission rate at a specific state and on particular day, and also the reporting rate, because we split the infected people as two components, right? The reporting and unreporting. So as expected, based on the the fast spread of the COVID-19 in March and early April, is that because we believe was that a lot of unreported cases, because based on the data assimilation process, in order to get the minimized error, we found that based on the modeling, we found only about 22% of those confirmed cases in early March were reported. So we believe that those undetected or unreported actually may drive the rapid spread. So further, based on this model, after we derive those parameters, we can do their prediction. So based on different parameter settings. So for example, if all the parameters took the initial values, all the transmission rate and reported rate, and we'll find that actually the whole US will get a very bad situation if all the parameters took their initial value and no stay-at-home orders at all. And secondly, we look at the travel flow. If the travel flow reduced to 5%, and while other transmission rate and then reported rate unchanged, remain unchanged, we found a little changes. So in other words, this might actually indicate, because the travel itself, if people keeping like wearing masks and also keep social distancing, so it could still have a good travel. So that is not a major drive factor. However, it's actually like the gathering, wearing masks, those are all proved to be more effective about production of this virus. And third scenario is if we increase the testing capacity, so which in fact the reporting rate, and then we can see thing will be slightly better. And the fourth one is most effective one, that is reducing the transmission rate, because that is a parameter directly affect the the confirmed cases. But how to control the transmission rate, it should be based on social distancing or other non-pharmaceutical interventions before the availability of the vaccine. And lastly, if we increase the report rate and also reducing transmission rate, we'll get optimal. In other words, combining those two will be most effective. And based on the modeling, we can also quantify the effects of the timely quarantine and social distancing mandates. For example, in the figure, we show you that at the x-axis show you the the days if we delay the the timely quarantine of an infected person, and in different states they will have different impacts. At that time, for example, for some states such as New York and Michigan, if the actual people, if they cannot be quarantined within 2 days, and the y-axis is the logarithm of the susceptible population ratio, so you will see that will be reduced very quickly, which means that a lot of people will be quickly infected. But for some other states which may not have a severe situation at that time, they may have some tolerance to the timely quarantine. So this is we believe this is very important for the state specific policy decision making support. And similarly, we actually built several dashboards during this pandemic response. This is another one based on the model we developed, and we further build a dashboard. Also, this also can be used as a education tool, because we actually serve different major students who actually are interested in this project, not only from geography, computer science, statistics, but also public health or some social science. So they can all play with the easily accessible web dashboard to understand the spatial spread of the virus. So the last study is a recent work we published in Proceedings of National Academy of Sciences of the United States of America. This is about another geographical scale analysis, the intra-county level modeling of the COVID-19 infection with human mobility, assessing the spatial heterogeneity with the business, foot traffic, age, and race. So one motivation is that because previously either state or county level, although the data are mostly available, but the geographic scale is coarse, we cannot detect the neighborhood disparity of this COVID-19 infection, because as we know, also hear a lot of news, this pandemic has impact on the community disproportionately, especially among underrepresented group and also low-income people. So this is why also similarly this is in our county, in Dean County, that is where our university and city of Madison, Wisconsin located at. This is a chloroplast map done by our students at the school in geography, and we got the data from the Department of Health Services at the census tract level. So this is also why we want to build the the mobility flow data at this level, because we hope to match different geographic scale. And this is a local dashboard we built similar to the previous state one, but we actually add one important measurement, that is a close contact. So which means that if two mobile devices, this is at the individual level, if the two mobile devices, they stay close to each other, unfortunately, because of GPS accuracy, we can only assume 15 meters. And then if they stay at there are several temporal thresholds we can set, like 5 minutes, 10 minutes, or 15 minutes. And then you can get, there is a proxy about the potential close contacts based on the detected mobile device. So this is a figure showing you also the spatial pattern about this close contact index at the daily basis. So based on those mobility and then those information, and we further build also a mobility-based intra-county SEIR model. However, this time, instead of directly couple the mobility pattern with the OD compartment model, we did one more step. So that is based on the origin to destination flow, we build a spatial clustering analysis first to understand which neighborhoods are more connected we believe that the neighborhoods which are more connected, they may have a similar dynamics. So this is one of our assumption in the work, and this is the overall workflow. We combine both spatial clustering and then the SEIR compound model, and to do the modeling. This is a modified version of the previously introduced ODE system, and this time after the spatial clustering, we can find out which area they can be identified as a node, and then their spatial interaction are built based on the flow information, and then we couple all of them together as a system. And we also introduce a stochastic effect term, which is add based on the previous SEIR model. So this is also the new contribution part, which has been used in weather prediction. So capture some of the uncertainty. We utilize this approach in the SEIR model as well. So this is, I think, two modifications we further made from the first work. Also, based on this model, we can identify specific information about whether such infection or the ratio of the infection are transmitted within each region or between different regions. So this is explicitly modeled in the system. So with different term, we can represent those newly confirmed cases are within the region itself or coming from another region. And by visualizing those interaction, we found that most of the infection took place, or the majority of the infection took place within the same region. So this is true for the Dean County. We also checked the Milwaukee County. We also found the similar information. And then because we divided, we segment the region into 7 or more smaller, some regions, we can find such a, transmission spatial heterogeneity. Also, the temporal variation are different. In other words, what we found is that, even for neighboring neighborhoods, their temporal variability of the effective, reproduction number could also be different. So that's actually, very interesting to geographers, because we study like spatial dependency and other spatial concepts. And, however, such a spatial heterogeneity also can be shown in the, in the temporal curve of their effective reproduction number, which show that on average, an infected person can, transmit the virus to, n numbers of people. So you can see, for example, in region 7, at the end of June and beginning of July, we can see a very high daily, infective rate. We actually look at several reports, also from the DHA official reports, which confirms our finding, because at that time our bar has reopened, and that has actually matched the business reopening phase. And also based on the actual hospital confirmed cases report, around the a large number, actually a large portion. So we have this specific number in the paper. A large portion of those infected cases at that time associated with those clusters. So either at the bars or at the small gatherings. So this is why we further want to understand, what caused those spatial heterogeneities in different counties. So this is the map. First of all, the orange color schema show you the cumulative positive cases in Dean County and then in Milwaukee County. And here we found that, this is the same segmentation or clustering result from the previous, result based on the OD flow. We can find that, for region 7, actually the, heterogeneity was associated with the age structure. So you probably already found that, because that is where UW-Madison located at, and then we actually had a large, large number of infected cases in last summer and over the fall, unfortunately. But from the spatial analysis perspective, that's also true for age structure here. However, for the Milwaukee, one of the most segregated metropolitan area in the U.S., we found that the spatial heterogeneity was not associated with the age structure, so it actually significantly associated with the racial population. So that is for two most infected communities, we found a lot of non-white Hispanic and Black people. So this is why we also call for the more attention, also to report at the state level why the understanding of the neighborhood disparity, and also we call the spatial heterogeneity, is very important when we do the response. For example, we actually made some suggestions, for example, for the fast testing, if we want to go to the neighborhood level, and how should we prioritize the neighborhoods based on such spatial heterogeneity information, right? So if it is more age structure based, and then we may have an approach, but if it is more racial and the ethnicity based, and then we may have another approach. So that is a major policy implication from this study. So finally, this is ongoing work, and that a lot of the previous work are all based on the local server or the local desktop. Right now, by the support of this NSF Geospatial Fellow project, we are fortunate to have the access to the SEIR GeoDS, which actually we can transform our model onto the SEIR GeoDS environment, and then basically we can build several notebooks. Right now, this is still ongoing work. However, I can share with you one thing is that, for example, previously we used some Bayesian framework to infer the transmission rate or other parameters. However, in the proposed work for this fellowship, I also propose that we can utilize different models. For example, some deep neural networks, and you can imagine for the outcome variable will be the transmission rate, and then the input features could be the daily mobility patterns, and could also be the previously mentioned the proxy of the close contact index, among other socioeconomic variables. So we put those independent variables into the model, and then the outcome would be the transmission rate. And then during the model training, and we also want to minimize the output confirmed cases, the error rate will be minimized compared with the confirmed cases. So this is ongoing work. I just would like to share with you, and also acknowledge the support of the SEIR GeoDS environment here. So a quick summary. In this webinar, I talk about how to utilize anonymized and then aggregated mobile phone data to help track mobility pattern, and also can be potentially used for the digital contact tracing, using such as the proxy of the close contact index, and also show you across different geographic scale and temporal scales what are the spatial temporal heterogeneity of transmission. And also for geographers, we pay a lot of attention about such a health and social disparity issues among different neighborhoods. So lastly, we learn a lot through this pandemic. Fighting against COVID-19 or other future pandemic, we require coordination efforts from multidisciplinary collaboration. So that is true. And those are the references for my presentation today. And if you are interested in any of our work, you can go to our website and to check more details. So with that, I thank you all for your attention.
Thanks very much, Sun, for that very informative talk. Kathleen, are you ready for your discussion?
Sure. Great.
Thanks.
Yeah, thank you so much, Dr. Gao, for your most interesting talk. That was great. And it was such a wonderful illustration of how a study on one area, in your case, mobility, really allowed you to end up in expanding and look at many different kinds of factors, including the social determinants of health, and many kinds of characteristics relating to mobility on the health side. And it was just a great example. And you've done a very impressive amount of work in the area. And so your talk today really highlighted what's been just a very important, I think, shift and trend towards this increased use and availability of open data. And what's been really interesting and rewarding over the past almost 18 months is this interdisciplinary drive to share data and push open data repositories. On both the health side, we've seen it with the availability of COVID-19 related data, and then also on the mobility side through the vendors that you listed, like Cubic and SafeGraph, et cetera, Descartes Lab. And these were available almost from the get-go, I mean, pretty quickly, which was great and really has been very encouraging of broad use. And I think your research really highlights just the really positive opportunities that can arise when we're able to exploit such open data. And you were able to complete analyses and then again, share further, contribute more data yourself through GitHub, through your research. And so again, enabling others to kind of pick up in some areas that you've begun and carry on with their own ideas. And that's just so important for our science. So kudos to you on that. Your talk really showed extensive use of dashboards, and we've really seen the growth of dashboards for science communication during the pandemic. When you see all of the COVID-related dashboards or the mobility-related dashboards, they're really great, and there are many, many to choose between. And they really offer a great benefit, as your work has highlighted today, about emphasizing spatial and temporal, as you describe it, heterogeneity. So differences. They're great for hotspot analysis or showing off clusters, for trajectory heat maps. And then, as you've shown with your dashboards, being able to track individual parameters like home dwell time or those kinds of variables. And so that's why I think they've taken off so much. They're a very understandable kind of medium. They encourage users also to interact with the dashboard and explore a little bit themselves the data and learn about the data. And I think the public has really responded with an interest in this. They do have some issues as well, of course, namely if the data is incomplete or perhaps out of date or is incorrect, then what's shown on the dashboard can be, could take users in a different direction. And with, for example, COVID deaths data, mortality data, as medical examiners have been sort of overwhelmed by cases, et cetera, there were kind of changes in data coming in. So our dashboards need to apprise users of some of these issues. They also don't work so well necessarily with lagged indicators. And so where there's a lag. And so that's another kind of aspect for users to also be aware of. But they've been really popular, and your talk really highlighted some great ones today. So your team has been investigating relationships, especially about one of the big ways in which mobility is important, and that's with social distancing or staying at home, and then looking for relationships with COVID-19 infections. And your work suggests that when mobility is lowered and stay-at-home protocols are enforced, then this can have a positive outcome on infection levels. And this and being able to show this and show this scientifically and show that you can get that result is really important, because you know, there's some discussion now that we're moving from pandemic to endemic, and we have these new variants in place that are more highly transmissible, and reducing exposure risk is still extremely important. And in some parts of the world, this is still, you know, they're in the midst of the big fight right now. So these kinds of findings that your work has highlighted, I think, are really important, and understanding what works with populations is even more critical, because we've seen around the world different sort of strategies. In the UK, they've had very strict lockdowns, where the population has been willing to lock down more or less, and they've been able to bring cases down as a result, and kind of demonstrate how well that sort of stay-at-home protocol has been working, especially in combination with vaccination as that's changed. And so your results of looking at mobility and stay-at-home protocols is very interesting and important. In other places, like in Canada, for example, they've also had a strict kind of stay-at-home message with shops and restaurants closed, but interestingly, some social policies, which are not as easy to capture, for example, in a dashboard, et cetera, have meant that individuals still want to travel for work. Mobility has still been going on as people have gone to work, and infection levels there have been really high, even in the face of long going and strict lockdowns. So the picture is complicated and kind of varies depending, you know, in different locations. So there's probably even more opportunity for research, I think, on this topic, to see how different populations respond. Your work also brought up the importance of multiscale dynamic human mobility, understanding scale-dependent kinds of behaviors, adjusting for scale effects, and really interesting to see the interesting behaviors. And this led you to explore also different models, like you discussed your gravity model and radiation model. And, you know, there's a lot of interest in spatial interaction models. And for graduate students out there watching today's talk, I think this is, again, another rich area that you can work on, you know, discussions on, you know, where do gravity models work best? Where do radiation models work best? How are they different? You've discussed travel distance and kind of distance related aspects to these models. And so there's still opportunity there, I think, that's very interesting and researchers can pick up. And so finally, I'll just wrap up by saying that, again, at the end, you had a very nice piece on linking mobility analytics and analysis with SEIR models, SEIR models. And again, another area really important, as you've been able to demonstrate, and again, leading a lot of interesting ideas, your idea of kind of looking more closely at how a compartment might be defined and kind of thought of, and how spatial heterogeneity, again, could be an important aspect for defining these kind of compartment-based approaches, is really interesting. And I think, again, open to additional research. And again, with these new variants coming in, where we have the variants are associated with different levels of transmission, and you know, we're hearing about more transmissible kind of variants, et cetera. Linking SEIR models with kinds of mobility analytics is going to continue to be a really important topic, I think, to look at, as it's not over yet, and we're still there's still a lot of opportunity, I think, for looking at this. And then just the role of prediction and thinking about prediction, and if with the terrible spike that the Midwest experienced last summer, and knowing what you know now, you know, what would your models show as a region is kind of going into that kind of situation again, and how your models could be used and be helpful is just very interesting to consider. So thank you. Super interesting talk today.
Yeah, well, thank you so much, Dr. Storr, yeah, for your excellent comments. So I think I'd like to quickly address two issues you raised, and before we move to the Q&A session. So first of all, you mentioned about the mobile data quality issue. So which actually we also found that such as for some days they might discontinue the data pipeline because some of the anomalies or other uncertain issue in the data provider side. So we do need to fill those gaps. So the first thing. And also the second thing is when we do get the data, if it's not the first-hand data, the secondary data, and we will analyze it, we will, if we do not know the provenance of the data, and then we actually have challenges. For example, we do find when we infer, for example, as we know, the safe graph data are aggregated at the sensor block group level, CBG level. So, however, because this is not individual level data, because of privacy, when we further aggregate, we extrapolate to the larger geographic scales. So, which will actually have a some scaling factor issue because if one device, if let's say he or she visited the multiple POIs within the same geographic unit, when we do the upscaling, we may actually repeat the accumulation of the same devices. So actually, there are several issues when we do the multi-scale analysis. So this is indeed a very important issue. However, because there is no ground truth, so it's very hard to fix this problem. So secondly, there was also seeing all the models in the pandemic were run, but some not useful, which also indicate that there are so many issues related to the modeling. So for the modeling aspect, it's more about understand what could be the scenario if we change one parameter or another, but actually most of them cannot reflect the actual confirmed cases well. So most of them can only do well in fitting the historical trajectory. But when we go into the future, even 7 days, 14 days will be very hard to get a very small prediction error. So this is indeed very challenging. So yeah, that's my answers or a follow-up to your great.
Yeah, it's great, and I agree. I agree with you.
Yeah. So maybe now I can move to the open questions. So I saw the question. First of all, is about actually our last study about intra-county modeling. I don't think I get the clustering in terms of SEIR modeling. Why did you create clustering? What are variables did you use for the regionalization? Yeah, thank you. This is a excellent question. Yeah, sorry for not mentioning much details. I just briefly introduced the key idea here. The reason was that we can still do a similar modeling framework like using the state level. Let's say if we treat if we have 100 sensor tracts in a county, we can do those 100. However, that's is actually to running the ODE, and also is actually very time consuming. This is one thing. On the other hand, because a lot of zeros in those sensor tract level rather than the state or county level, you will not have a lot of zeros. So this is why we found that the model cannot converge well when we directly model the transmission at the sensor tract level. So this is why we need to find out a way to aggregate those small sensor tracts into a larger subregion. So this is why we want to use the spatial clustering, and specifically we actually use a graph-based community detection, so which I also used in other mobility studies a lot, and to get those clustering or segmentation of the OD flow injection. So that's the reason. So that is the first question about this. And also, I do want to mention, I forgot to mention because right now we have the support of CyberGSX. One good feature about using CyberGSX is that we have access to the cloud resources, also high performance computing server. So now the computation time might not be a concern anymore. So this is why we can maybe try, because all those models are already there, and we can try whether we can run more, more nodes at the same time. But before, limited by the computing resource, that's also one concern. But most of the reason was because there are a lot of zeros in those sensor tracts, small units. Another question is for the intra-county modeling, could you please explain your logic behind how you choose to model the intra-county metropolitan areas? While there are a minimum number of total infection that would allow accurate model. Yeah, thank you. So Abby, this is a very good question. First of all, the number of the regions detected was not determined by us, was actually determined by the clustering algorithm itself. This was actually one challenging issue, because we found that there is some uncertainty or variability if we choose different week of the mobility data, or if we use a just different algorithm. However, this is why in the sensitivity analysis, we actually perform a very comprehensive sensitivity test. So on one hand, we choose a different algorithm. On the other hand, we also choose different week of data. But all then we took the different result and run the modeling, the coupled mobility with EIR model again, and we found a similar conclusion. So this is actually we treat this question or this concern very seriously. We think that that may help conquer some of the low accuracy issue if we directly model the individual sensor tract level. Because of those the insufficient observation issue. And another question is, what is the geographic unit that is used for the ACS data set? We only use a county level data set for the ACS comparison, because one reason also for creating the open flow data set was also the OD flow as a county level or even fine spatial resolution level. SAS only updates every 5 years for such a detailed OD flow, so we do not have such a fine temporal resolution of those OD flows. This is also why we want to create such a fine temporal resolution OD flow data set. So how big of your safeguard data? So the number of records. So this is really depends about the about either at the geographic unit, right? Like sensor block group level, there are around 200,000 CBGs, and then the size actually huge. Even after compress, the daily data is over 1 gigabyte, and you can see accumulation show a lot of data storage and computation involved. And which software did you use for the gravity and radiation modeling? We actually wrote our own algorithm, so in Python. So actually this is open, so it's open source. So we actually already, I believe we already publish on GitHub. I think so. So if you check our our GitHub for the data, we also show you the gravity and the radiation model part in Python. Do you have any suggestions of other types of data for those places where cell phone use is not widespread or connectivity is limited, remote area? In many parts of the world, including US, those marginal regions, yes, have already multiple sources of vulnerability, are not prioritized for vaccination, or people in this region might be more skeptical and then vaccination. Yeah, thank you. This actually excellent question, and also take as a comment. Indeed, because even we try to extrapolate the the population coverage from those detected mobility, but still those, the sampling of those population is still only in those users who have access to the mobile phone or use, right, those different mobile apps. We do not have, the information about those remote area people if they do not use such a mobile device at all.
Well, maybe I could jump into this
Yeah.
one and just suggest that if you're interested in sort of global data, the COVID-19 Global Symptoms Survey in conjunction with Facebook and the University of Maryland, and Carnegie Mellon is fielding the US survey, but we are actually fielding the rest of the world. And we are collecting daily data from more than 100 countries around the world. And there's questions about vaccine acceptance, vaccine hesitancy, all kinds of questions. And it's at kind of administrative region 1, but we are going to postcode level for 10 countries. That's going to be coming up soon. So if you're interested, that might be something that you would want to look in. It's the COVID-19 World Symptoms Survey, University of Maryland. And although for mobility data, that is more difficult if you wanted to. That's really all kind of on the COVID and human behavior side. But if you're interested in mobility, then that can be more tricky to get for sure for certain countries around the world. So just depending on where you're interested.
Yeah, thank you, Catherine. Yeah, that's an excellent answer. So the next question is what geospatial data is missing that if they improve the results. So actually I'm not sure which part of the results are you talking. So maybe if you will be available later, you can actually join the panelist and we can have a conversation. So I'm not so sure, because we have several results. Yeah, but happy to chat with you later. And what are the most popular open source mobility data used in human mobility research? Yeah. So this question, later you can also check the slides, and also the video will also be available on AAG website. And we mentioned that for the aggregation, just some mobility index such as travel distance or travel time, the report such as Google Mobility report was widely used, and what we mentioned, the safe graph mobility data was widely used in the US, also the cubic data and also the GeoDS Lab data. So we all list those. I think you can find those answers in the slide. And last question, I think.
So maybe I could quickly chime in here, since we're about at the end of the budgeted time for the webinar. I want to take this opportunity to thank you and Kathleen so much for your wonderful talk and Kathleen's insightful discussion and your so efficient handling of the questions. And I want to give the participants an opportunity to put their hands together as well to applaud this wonderful sharing.
Thank you. Yeah, my great pleasure.
Yeah, so the folks wanted to stay to continue to ask questions, and I think Son and Kathleen could perhaps stay a little longer, and you feel free to post additional questions in the Q&A, and after a little while we will sort of activate you from this webinar format into the meeting format of the Zoom, so that you could directly just ask questions without typing. And I see Colleen is perhaps already doing this. Yes.
Yeah, I think so.
Yeah, more people are, I think, joining. We still have a sizable group, although I think good number of participants have left, given that we've already passed the hour. But yeah, super interesting topic and wonderful wonderful research shared today. So So I think I'll turn that back to you, Song, since you are still talking. I interrupt you. Sorry about that.
No. Thank you, Shaolin. Yeah, I think I think we almost finished. I think a team is here. Team's question about what other geospatial data. I wonder, yeah, if you are here, please feel free to share. Or I think he left. Okay, so others, yeah, if you have any questions, also feel free to unmute yourself now.
Yeah, Timothy left. I think one of the most significant challenges and opportunity in terms of having additional data is likely about focused survey data, meaning the data to help validation. We have a good number of now open data or data you could get through maybe some investment for data purchasing at a pretty large scale population level. But we are, in general, as a community, struggling to really validate the findings. And I think that's critical to go from exploration, explanation to prediction. So if we could either partner with industry or have research focused on instrumenting particular population to get that data, even at limited population level and small scale, to help validate the modeling work, I think that could be a big step forward.
Yeah, thank you, Dr. Wang. You remind me actually, in one of our research, we do need to, for example, understand from different neighborhoods how they actually, first of all, whether they believe the social distancing and stay at home is effective in protecting or preventing the virus transmission. Yeah, even we, for us, I think it's obvious, but I realize not everyone think the same way. So this is why we hope to actually see whether such a people's perception or the acceptance or the adherence level and to those public health guidelines, and whether that can also drive some of those infection patterns. I think those are some of the data set. If we have availability, if any, I think it definitely will be better to use for validation purpose.
Mm-hmm.
And I think Sue still have one more question about the clustering. So specifically, we use for example, if I take any time periods of the origin to destination flow between different sensor tracts. So if we use a tract as this is graph algorithm, right? So if you take a sensor tract as a node, and then the flow as the flow as between different sensor tract as the edge, and then the flow volume as the weight of the edge, and then you can put the graph-based community detection results, which will aggregate those different sensor tracts into different groups, such that the intra group or within group interaction will be maximized, and then the inter group interaction will be minimized. The assumption was also based on our previous work. We assume that because the spatial spread of this virus rely on the mobility or the travels, right? So travel, one infected people travel to another area that may not have virus yet. So that is how the newly confirmed cases might be introduced. So this is why we believe the more can interconnected the region by the mobility flow may have some similar transmission evolution dynamics. So that was our assumption. Yeah.
Great, thank you so much, Song. Now, I guess I have one more question based on your answers. So then what clustering algorithm did you use then? Because I know there are so many different clustering algorithms, so have you tried?
Yeah,
many?
we try several, so including random walk and also the Lavance community detection. So one of the mostly used modularity-based detection method. So Lavan and archetyping, and then random walk. Yeah, that is the algorithm we used. I will type in. Yeah, I think others, since you are here, any other comments, suggestions, or questions?
Just gonna rudely interrupt to say, I'm gonna stop the recording so that in case anyone prefers not being recorded while asking this question, I'll stop there. So again, thank you for everyone to have provided their comment. And this is gonna be the open part, non-recorded part.